friends, I'm Nurse Lizzie. Welcome back to my channel. In today's video, I'm going to review with you my top 5 recommendations to help you ace your pediatric nursing course this semester. Before we go ahead and get started, please be sure to hit the subscribe button below, give this video a like or thumbs up, and don't forget to check out my website, nurselizzie.com, so you never miss any of my educational uploads, life hacks, and facts. All right, let's go ahead and get into these top 5 tips. So students ask me every semester, how am I going to ace pediatrics? Many of them bring to the table concerns that they're not really interested in kids or they're not interested in the peds rotation. But regardless of whether you decide you love it or hate it, you do just have to go through it. It's part of the nursing school curriculum. But there are some tips that I have that I'm going to share with you, and they're the same tips that I share with my students in class at the beginning of the semester in order for them to be successful, because we all want to ace the class and get the A, right? All right, so let's go ahead and look at and talk through these top 5 tips. Tip number 1, you have to understand growth and development norms. That is such a huge part of pediatric nursing, and it really helps us as the providers to know if kids are meeting appropriate milestones. Part 2 with that, you have to brush up, you have to commit to memory, Erickson's stages. So if you think back to developmental psychology, when you would have learned this information, we're going to dust the cobwebs off because we're going to need to apply those Erickson stages to patient care in the pediatric setting. Think of things like infants, trust versus mistrust, toddlers, autonomy versus shame and doubt. If you don't remember those that terminology in those stages, this is the one area in peds nursing where I think flashcards are super helpful while you're studying, just to help you to see the age range and what the Erickson stage is that's associated with them, because I guarantee you're going to need to know that. You're going to be tested on it throughout the 16-week semester. Third, under this part of part number 1, apply growth and development to patient care. All right, so what do I mean by this? Let me just give you a simple example. Say we have a 4-year-old who's in the hospital with pneumonia. They developed it postoperatively. It's really delayed their discharge to the home setting, and we really need to work on airway clearance with this patient. Well, you guys know from adult world, it's easy for us to utilize incentive spirometry or the flutter valve. That's not something I may be able to do with a 4-year-old patient. That would be quite a big learning curve. But what could I do with them that helps to meet their play needs, increase, socialization with me, and just let them have some fun? I could grab bubbles. That motion of them blowing bubbles through a bubble wand is going to work the same way them blowing through the incentive spirometer would work. All of this to say that these developmental milestones are key, okay? So you're going to talk a lot about the first 12 months of life and what those specific milestones are that we're anticipating patients to meet. Things like head control, crawling, walking, babbling, all of those things that are going to be familiar to you eventually as you're learning them. You just need to know them. You need to commit them to memory, both for boards and for class, because I guarantee you that once you get through the growth and developmental unit in pediatrics, your faculty members are still going to be testing you on that knowledge, and they'll apply it into disease processes as you get going further on. Tip number 2, if you're not already doing this, I highly recommend you should be looking at 10 to 15 NCLEX questions with rationale each and every day. All right, so let's talk about this for a second. My preference for you is that if you're in a pediatric course, you should absolutely be looking at pediatric NCLEX style questions. And there's tons of books on the market. You can buy pediatric only books. You can buy books that are really covering the whole nursing school curriculum. There's a lot of apps out there for our smartphones, but I want you to think about it. There are 24 hours in a day. This 10 to 15 NCLEX questions at minimum is only going to take you about 10 to 15 minutes. But what's most important is that when you're looking at those questions, you need to be looking at them with the rationale. So you need to see, and that's part of helping you build critical thinking. Why was it right or why was it wrong? That's really, really important. So I can't stress that enough. If it's not something you've done yet, please, I highly encourage you to do that and see how your test scores might change and how this might help you to really dissect an NCLEX style question, apply nursing knowledge, and pick out the key components that we're asking you about. Tip number 3, when you are in class and your instructor provides you with PowerPoints, study guides, and assigned reading, it's for a reason. So if you're not already doing this, You really need to utilize your PowerPoints. Be taking notes actively in class. Be an engaged learner. If there's a study guide, you should 100% be looking at it. It's a guide to studying that's going to help you to narrow down some of that content, or maybe some of the content areas that students historically struggle with, to help you focus while you're studying. Read before lecture. I can't stress this one enough. I realize we are all busy people, and sometimes it can be daunting to just look at one more thing in nursing school. It's one more thing on the to-do list. But I got a secret for you. Students that actually read before they come into class and they've seen some of the content that we're going to talk about, they've been exposed to some of the vocabulary, the disease processes, they're that much further ahead, because once we start teaching you and talking about that content, your brain, your eyes, you've already seen some of that. You're going to be further ahead. Trust me, because you read before you came. So now you really can actively be an engaged listening learner. And it's going to help you immensely. Trust me. Tip number 4. Okay, so we talked a lot about growth and development, and I'm sure as you begin nursing school with pediatrics, once you're in that course, you're going to be like, wow, she wasn't kidding. We really talk about growth and development. But the other big part of pediatrics is we're going to really dive in deep to the disease knowledge. It's going to be system-based. So the cardiovascular system, the respiratory system, neuro, GI, musculoskeletal, all the things. But we're going to go in deeper to some of those disorders that we see among pediatric patients. Things that we're really looking at and what you need to know. What are the presenting signs and symptoms of the disease? How do we diagnose it? How do we manage it? How do we treat it? What are the things that we're doing? Okay. If you can apply this knowledge and then pull in growth and development to the patient and the disease processes that we're talking about with the patient's age, you are going to totally ace pediatric nursing. Trust me. And lastly, pediatric dosage calc. Okay, we all have to learn dosage calc when we go into nursing school. It's part of what we have to do to administer medications safely, following the doctor's order, and making sure that we're giving them exactly what is ordered. Pediatric dosage calculation might be a little different than what you've already experienced in your fundamentals courses. So pediatric dosage calc is weight-based. Everything we do for kids is weight-based. It makes sense. A 1-year-old patient and your 13-year-old patient do not get, nor do they need, the same dosage of medication. So you need to get familiar with how you do these calculations. And I promise you, your nursing instructor and faculty member, they're going to expose you to that. But keep practicing how to do those calculations, because chances are it's going to be on more than one exam in nursing school, and you could very well have to do a dosage calculation problem on your NCLEX exam. You just don't know. Whether you love peds or hate peds or just don't really know how you feel yet, keep an open mind. This is all part of things that you need to learn for nursing school in order to sit through your NCLEX examination and successfully pass, so that you can get those initials behind your name. That's what we're all working towards, correct? But when you're engaged, when you're asking questions, when you're doing all the things I'm telling you to do to ace your course, you are going to be that much further ahead this semester to really ace pediatric nursing. I hope these tips were helpful. Please be sure again to hit subscribe, give this video a thumbs up, and I'll see you guys next time. Bye.